Okay, so we're going to be looking at overhead shoulder mobility. So when we lift our arm and our elbow flexes, or we lift our arm and we feel stiffness in the shoulder capsule in its general or kind of in this crescent shapes in the posterior aspect of the shoulder or deep within the shoulder, any of those descriptors would suggest that we don't have enough rotation above our head in our capsule. So one self-check that I could do is I would go like this, and then I am sitting on a stool, and I'm going to rotate back. And as I rotate back, you can see that I collapse in, meaning that I've lost my external rotation, despite my best efforts to hold and sustain my forearms there. Okay, so what is the cure for this? The cure is using some long duration stretching and some contractions to do so. So I'm gonna now have a rigid lever, golf club, cane, dowel, all work well. Okay, so then I'm gonna go back into it, which now I can sustain that external rotation. There's gonna be 4 phases with this. Phase 1 is gonna be a long duration stretch where I'm gonna push my arm out to my right and stretch. Okay, so that's my end range. During this 1 minute, I'm gonna breathe in, 4 seconds in, 8 seconds out. This helps to stimulate my vagus nerve, relaxing my central nervous system, allowing tissue extensibility to blossom, and I may gain a degree or 2 further. Thereafter, I'm gonna engage, and that is to say, I'm gonna try and actively push into internal rotation. So it's going to be unremarkable because I'm going to hold strong with my left. So it's going to be an isometric contraction. This is going to induce architectural change within the shoulder joint as I engage the deep tissues, that is my rotator cuff of my right shoulder, putting mechanical impulses into the capsule to make it change range of motion. I do that for 30 seconds, incrementally, gradually increasing my force. My safest, greatest contraction, as hard as I can go, to my right, to my left in this case. Phase 3, I'm gonna actively, as best as I can, try and pull the cane to my right. Okay? So all my deep tissue on my right shoulder is now pulling out to the side. 30 seconds, as long as I can go. Keep going, keep fighting, keep working, keep doing it. Yes, good. Then, end of that, I solidify the new range of motion by breathing 4 seconds in, 8 seconds out. Okay, not just surviving the position, but trying to own it. Okay, I'm going to slowly come up and out of it, knowing that it's natural for my shoulder to be a little bit achy and stiff and feeling like it's just worked really hard. If I give this impulse and this stimulus to my tissue day in and day out, I'm going to make meaningful changes over weeks, days, months. Good. Okay, we're going to be working on an exercise that's going to help with internal and external rotation capacity of the shoulder. So you're going to push all the way off to the side as far as you can go, whatever that may be. Notice that my active range of motion is there, but I need to go further than that. I need to go to my passive range of motion. So I'm going to start off with good proud chest, gently pushing down into the pad, which stabilizes my scapula and my lower tract. I'm then going to introduce the load, and I'm going to fight. So I'm going to, though you can't appreciate any physical or external motion, I'm trying to bring my arm further out to my side. This contraction induces tensile load into my capsule from the rotator cuff that allows for architectural change over time for strength and weight-bearing capacity. I'm going to go 20 degrees down, I fight again, 5 degrees. Fight, work, doing it. Okay? And then I go another 20 degrees. 20 to 30 degrees is significant because that's the arc of motion that isometric contractions actually have effect. Keep going, keep doing it, keep winning, go a little bit further, fatiguing, As I get lower, it gets harder because the rotator cuff muscles become stressed. Once I bottom out, which is just about there, I do it again. Find that passive range, and I fight for 5 seconds incrementally every 20 degrees. Keep working, keep fighting, keep doing it. Great. Your body cares most about mechanical tension. It also cares about the time under tension of that mechanical tension in order to induce changes. So I usually prescribe this around one set of 5 repetitions. That would be a sufficient amount of time to actually induce changes, and you should feel fatigued by the end of that. If you feel as though you have more capacity to give, by all means you can do more repetitions, but trying to get your shoulder and the rotator cuff into a fatigue state that would also give sufficient stimulus or inputs that would force your body to change. Additionally, it's not just about strength. This is much more than that. This is about building tissue capacity. That is to say connective tissue. That is the joint capsule, the ligaments, the tendons within the shoulder. And really, by doing these slow duration end range contractions, you're going to allow for better capsular space, allowing for better overhead motion over time.